Physical assessment and care plan. That's that's module 6. Yes, I think that's the last module I posted. Module 6. We say that physical assessment is a systematic process of examining a patient to gather information. So physical assessment, just like the word physical, is the assessment you will do to a patient whenever you meet a patient. Now we are using the word patient for everyone, both carer or care receiver, client, anybody. We want to use the word patient for easy going. Now, so when you meet a patient, your first contact, the first thing you do is physical assessment. Okay, that's from your eyes. Physical assessment, you have four parts. You have the observation. That's number 1. Observation is what your eyes and your special senses can identify. Talk about what your eyes can see. The appearance of the patient. Is this patient walking? Did they bring the patient in on unconscious, on clutches, on trolley? You are going to, that what you are observing will give you a sense of what you will do. You understand? Yes, to the patient. When you see someone coming into the hospital, the first thing you do is look at the person. And when you look at this person, you can easily know your first line of action. If it's someone that walked in and their face is not looking distressed, you know that this person is stable to an extent. Okay, so it's a matter of talking and asking, what can I do for you, and all those things. But if you meet someone that maybe held their stomach and is coming in a bended way, the first thing you do is to get up and go to them. Yeah, so that's observation. You have to observe the person coming. Let's say you met the person sitting down or lying down, you will still have to check their appearances. When you look at someone and see that this person is very fat on a bed, already your mind starts telling you that this is a case of a heavy patient. So you start thinking of the things you will do. Already you will be like, this kind of patient, I cannot carry this person by myself. So in your care plan, you already know that you will be needing assistance. Whatever you want to do with this person, you need assistance. So that is observation for you. You are observing to know. Now, when you meet someone that has mental illness, their physical appearance and the way they behave will show you, even without asking question, you will just be like, this one, you be like, say something, they happen. You understand? Yes. You may just meet someone, the person, good morning, and the person start laughing, or the person is scratching their hair, or is killing mosquito that is not there. You know that, this one, you'll be like, something is wrong. So your mind already is telling you that this person may not be mentally stable. So the way you will talk will not be the same. So that's observation for you. Then you talk of another one, inspection. When you are talking of inspection, that's number 2. It is as well using your visual ability to find out what is happening. Okay, you are going to be using your specialist. You are inspecting, you are investigating. Now you are coming in contact with this person, and you see doctor looking at someone's eyes to know the color of the eye, looking at the palm, looking at the leg. Is it swelling? You will press it to know if it's going inside, to know if the person's leg is swelling. Is the stomach protruded? You touch it. Is it painful? Is it you touch with the back of your hand to know if this person is running temperature. Even before you check, you can easily tell when someone is having temperature by touching. Okay, by using your eyes to see, using your ear to hear the way this person is talking, you can be able to know if he's talking well or not talking well. So inspection is using your special senses to investigate by touching, looking, and all those things. Then the third one is palpation. That's number 3. Palpation is using your hand to feel. Just like I said before, you are inspecting, you're looking, you are palpating. You know, all these things, they go hand in hand. There's no one you just do this one, okay, I'm done with observation, let me go with inspection. These things are things you are doing together. You're observing with your eyes. Now you try to inspect whether what you observed is true. Now you want to palpate, you touch. Okay, when you palpate, you'll be able to know the particular place the person is having issue. When someone says, my stomach, my abdomen is paining, now you have to palpate. Is it here? Is it here? Is it here? Okay, until you are able to find out exactly the place the person is hurting. When someone says, I'm having a headache, you say, are you having, is it your eyes or your, you kind of touch the place to know exactly where. So palpation involves using your hand to feel, to press, to feel, and know exactly the point the person is having problem. Okay, when you are palpating, you can see a mass, a boil, you can see a lump, you can see that someone is having if someone has a muscle spasm, for example, if you touch that muscle, you see it very strong. Okay, you say, this person is having muscle pull. Yes. Okay, then we now talk of the last one, which is percussion. Percussion is using sound wave to find out a problem. That is, you are using sound wave. Is if someone has problem with stomach, let's say protruded stomach, you can be able to know whether this person has water or mass. Now or gas, when you touch the person and you try to tap, so percussion is tapping to know the sound you will hear. It is the sound wave you're trying to hear. Sometimes when someone has water in their and also in their lungs, by percussion they will be able to know. So percussion is using sound wave to examine the internal system. And finally, you have the one you call auscultation. Auscultation is using stethoscope. Auscultation is using stethoscope to listen. You know what stethoscope is? That's an instrument you fix in your ear and use the cuff to check. So auscultation is using stethoscope to listen to the internal part of the body. And when you are using that stethoscope, put it under your left breast, you will hear the sound of the heart. You'll be able to count heartbeat. Also, when you put it in the stomach, when someone is breathing, you'll be able to know if air, the movement of air, you will hear it. Then if someone has like water in their lungs, or in case of pneumonia or asthma, when you are listening, you hear that the sound that you will be hearing there will not be the normal breathing sound. It will be sounding as if someone is blowing whistle. It means that the lungs is tight, it's constricted. The respiratory tract has issue. So you can use a kind of stethoscope to listen to baby fetal heart, a baby's heart sound. When you come for antenatal, they will use a kind of stethoscope, but you call it fetoscope because it's for fetus. Fetus is baby, so you use it to listen, to hear the baby's sound. So that's auscultation using stethoscope. Okay, so we talk about components of physical assessment. That's what are the things you will do when you are doing all these things. These things are physical assessment. What will you do when you are doing all these things? Among the things you will do, number one, the components. That's what are the things you will do? The first thing you will do is vital signs. The second one you do is to check the general appearance. Another one you will do is to check the past and present medical medical history. And another one, you assess their social, cultural, and economic life. Okay, and how it influences their health. So first of all, you are going to be checking someone's vital signs, and we will talk about vital signs later. You talk of general appearance. You are not just looking at the face or the skin. You look at the facial expression, the color of the skin. Is the face the same color with the whole body? Is this person pale? Is he looking yellowish? For example, my grandfather, when he was taken to my aunt, so while they were there, one of my other aunts went to visit him there, and he found out that the man is very yellow. It was like, I know that my father is fair, but this fairness is over fair. Are you rubbing cream? What is this? One is not normal. So they took him to the hospital. They went through investigation and found out that he was having a liver problem, and that liver problem, in fact, his liver is damaged, and there is something you call bile. The bile is a kind of substance that goes out of the body after digestion and everything. Is a kind of waste product that will go through shit. That's the color of shit. That thing that makes shit yellowish in color is that thing. So due to the fact that his liver has failed, he is no longer removing waste products. So that yellowish substance that the body is supposed to remove through shit is still in his body. So it entered his blood, and he's now yellow like that. Okay, that's how they started treating him. Okay, so assuming the other person was not observant, he will not be, but he has been living with someone else, and that one felt like, I'm feeding this man well, that's why his body is shining, not knowing that he's actually going. In fact, from there, he didn't actually survive that. Assuming they knew when he started, maybe they would have, but then he's an old man, what does he know? So you check skin color, you check the body weight. You may see someone, you are looking good, you don't know this person is swelling. Someone that has liver problem, if you see them today and see them tomorrow, you'll be like, you are enjoying, see you don't dey fat. You don't know it's poisons that are accumulating in the body. So these are the things you will check. Check the person's gait, how they walk. Are they walking well? From the way someone is walking, you can easily detect that maybe this person has waist pain or leg injury or something like that. So you check general appearance. Then you talk of past and present medical history. You need to know someone's past medical history in order to know how to relate with this history. Now, when you hear someone say, I have been vomiting since yesterday, you will ask, when did it start? After eating yesterday, what did you eat? I ate amala. Now you are going to ask, whenever you eat amala, do you experience the same thing? That's past medical history. You want to know? No, this is the first time it's happening. Okay, have you ever vomited before? Yes. What happened? Maybe like 2 weeks ago, I was vomiting. What did you eat? What happened? What happened around then to know what, the person will give you a history that you may want to join with the present history, and you'll be able to know that, okay, this didn't just start now, it's not acute, maybe it has happened before. Okay, maybe there's something you're eating that is causing it. That's it. So when you are attending to someone in your level of care assistant, you want to know the history of this person as far as health is related, so that you will know what is expected of you to do now. Okay, this person is on oxygen. You have to know, since when did this oxygen thing start? Has he been on oxygen? Okay, how has he been taken care of since then? Is it that he's on constant oxygen, or intermittent oxygen? So that it will help you to know how to take care of them. Maybe another example is nutrition. Someone is on diet. You want to know why did this person, why is he on diet? And when you say, okay, because of the weight, you want to know, when did this person increase? What happened? Why is he obese? Why? So you'll be able to know if this diet, how serious you're going to take this diet, how important your care is by knowing their past. Then you talk of social-cultural economic life and how it influences their health. You need to know the social and cultural heritage, cultural diversity, the society, the class your patient is. When you, as a caregiver, when you're taking care of someone, you need to know their financial status, so that when you're going to market to buy foodstuff, you know the one you will buy, how much you will buy. You will not write a list of 1 million naira for one old woman who can only afford 50 naira. Okay, you said, okay, you eat white meat, chicken laps, eat turkey. Then we are going to buy fruits. We buy watermelon, we buy pineapple, we buy this, buy. Whereas nothing is in the fridge of the person you're talking about. Okay, so you need to know how rich they are. It will help in the plan of care. You need to know their cultural belief. You don't go and cook pig for a Muslim. You don't go and cook dog for an Islamic, strict Islamic person. In your plan of care, you write dog meat. You don't go and start cooking snake pepper soup for someone who such a thing is an abomination. Like they said, Indians don't eat cow. Then you go and cook beef. There's a problem. Or maybe this person is a Chinese person. They believe in their Buddhism and yoga and everything. You know the time for their meditation and prayer. That is when you want to go and tell him, you come and take your bait. Okay, all those things. There are things you need to know, their culture, what their culture prohibits, what is acceptable, how you refer to them. An African will not allow you to call them by their name for any reason. Mommy, daddy, brother, sister. Nobody wants you to call them Toyin, Mrs. Shukura, Mrs. Chinwe. No, they want that respect. So you need to know their culture and their beliefs. Then their social class. You need to know their life, and as it relates with their health, you will know. A Christian that prays a lot, you know that if they don't listen to their pastor, they don't feel all right. You want them to go and sleep, but they want to listen to Pastor Joshua. Or if you want to work well with that person, go and get Pastor Joshua track. Play it for them. They will be happy. And they will know that you are sensitive of their culture, of their belief and their religion. You respect their religion. You would say maybe because you are not a Muslim is your care recipient. You know their time of prayer. You know the things, the way they do. And then you say, oh, not a Muslim. I don't believe in Islam. I can do, No. You don't ever show any contempt or, judgmental. Or maybe someone is a gay. and you are just showing that you know, anger for them, and as if you are irritated by you're there to take care of a man and the wife is a man, and you'll be like, wow, this kind of job. This one is Mr. This one is Mrs. All of them man. You don't even know what you are doing here. And I say she. You know, in your own mind you'll be like, she call my she. Now wow, she na Bobrisky be this one. But all those things can happen in your mind, but not with, you shouldn't show it. So that's it. It's going to help with attending to your patient. Okay, so we go over to vital signs. That's the main thing. We're going over to vital signs. So when you talk of vital signs, I told you guys before, I said vital signs, simply put, is those signs you see in the physical that tells you what is happening in the internal system. Okay, there are things that you see, you observe. There are perimeters you measure physically, but they are giving you information of what is happening internally. That is the simplest way to define vital signs. And for the purpose of this class, we have 7 vital signs. Number 1 is temperature. Have we done this before? We did this. Paraphrased. Okay, yes, I said we'll talk about it. Okay, we said temperature, and we said that temperature is the measurement of the hotness or coldness of the body, and that the instrument for measuring temperature is what? Thermometer. Thermometer. And we said that normal body temperature, or rather the unit of measuring is degree Celsius or degree Fahrenheit. So whichever one that your organization is using, when you measure, you will end up writing degree Celsius. For example, if your temperature is 36.5, you will end it with degree Celsius. That's or you say it 95 degrees Fahrenheit. So that's how it will end. You are going to add degree Celsius or degree Fahrenheit. Okay, you have normal temperature to be between 36, that's normal temperature to be between 36.5 to 37.3. Some people say 0.5, okay, but 37.5 is not a bad temperature. So 36.5 degrees to 37.5 degrees. Then if you are measuring in Fahrenheit, you say it's 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. So you can see that both of them, there are ways to measure. You can convert this to this, you can convert this to that, and the best and easiest way to convert is to use your internet. Whatever you get, you want to convert to the other one, type it, convert so to degrees Celsius, or convert this one to degrees Fahrenheit. It will give you the reading immediately. You write it, no need wasting too much time. Okay, then we have alternative, or rather abnormal temperatures. Okay, when you talk of abnormality in temperature, abnormalities, you have high temperature, you also call it what? Pyrexia or hyperthermia. That's when someone is pyrexic, the person has high temperature. When someone has hyperthermia, the person has high temperature. Okay. Now, in a situation where someone has high temperature, what do you do? What do you do? How do you care for someone that has high temperature? The first thing you do with high temperature is to expose the person to fresh air, so that there will be mixture of their temperature with the normal temperature. So expose. You can expose by opening the windows, putting the AC on or the fan. Then you will use tepid water. That's a water that is neither hot nor cold. That's lukewarm water to bathe them, so that the temperature will come down. These are things that you as a caregiver should do. You don't talk about medication. It's not your business to give medication. So what you do when I say the first thing is to expose to normal air, and the next thing you do is introduce air. Introduce coolant in form of AC or fan. Then the next thing you do is give cold drink. The cold drink can be water or juice or milk drink. Then another thing you do is bathe. Let them shower with tepid water. Okay, so you give this person with high temperature a lot of cool water. It mustn't be ice cold, but something below normal temperature, cool, so that their body system will, the temperature will come down. Then as you are doing this, alert your supervisor. You don't just you do the actions you have to do, the normal one, while you inform your supervisor. They will know the next thing to do. Okay, and when you are done with bathing, the next thing you do is you check the temperature again. So you keep monitoring that temperature, you keep checking it. Okay, you keep monitoring. Keep monitoring the temperature by checking it at intervals. Okay, then if drugs are prescribed, you can monitor the person take those drugs. Okay, maybe paracetamol or any antipyretic drug, you will monitor. So this is one. Then we talk of low temperature. When there is low temperature, what do you do? Okay, we didn't talk about that high temperature. Write that high temperature is when the temperature is above 37.5. It can even get up to 40. Okay, then you talk of low temperature. Low temperature is when it is below 36.5 degrees Celsius. So when it is below 36.5, then it is low, and below 36.5, when low temperature. High is when it is above 37.5. So now one thing you will know about low temperature is that old people and babies, sometimes their body is colder than the normal adult because they are not into any form of activity. If you check my temperature now, it will be higher than the patient's because she is lying down, she's not doing anything, she's under fan, she's under good condition, nothing is okay. Her temperature will be okay. The same thing with a baby, a newborn baby, and an old person who doesn't have much activities. Their temperature can be 36, you won't consider, there is no cause for alarm because they are inactive then. But in a situation of someone that is normal and is going through their normal activities, the temperature goes low, or someone that is sick, someone that had an accident and is bleeding actively, if their temperature starts coming low, it's a sign of danger. They can go into shock. When someone receives a bad news or something like that, if their temperature start going low, it shows that maybe they will go into shock at the moment. Their body system is not working well. Yes. So when someone is cold, I said low temperature can be as a result of severe bleeding. Okay, it can be as a result of dehydration, when someone is severely dehydrated, then when someone is sick, and then when someone is feeling cold, the person will have low temperature. And so what do you do when someone has low temperature? What you do is, the first thing you do, what you cover the person up. You cover up, okay, with blanket. And you cover them with blankets, cover their legs and their hands with blankets. Then you report the situation. You check every other vital sign. When someone's temperature is low, you will need to check other vital signs: the heartbeat, the pulse, respiration, everything. You have to check everything to be sure that they are normal, that it's just cold. Okay, this person may require intravenous infusion. They may have to put drip for the person in order to, a warm drip. They will warm the drip and they will warm it, not cook it. They will just put it in hot water. It will be warm, then they will pass it to the person. Yes, to reduce that coldness. The person then, most times low temperature is indicating danger of heart attack or something. So the care professional team will be informed as soon as possible so that they will come and attend to the person. But as a caregiver, what you need to do is cover this person, continuously check the vital signs, every other vital signs, then report. Okay, you report immediately. You have to raise that emergency alert so that they really attend to the person. So we go over to pulse rate. So what is pulse? We said that pulse is the force exerted on the arteries as blood is pumped through it. Your artery is the pipe, let's call it a pipe, that connects every part of your body and makes sure that blood is going to every part of your body. So these arteries, they are carrying oxygenated blood. Oxygenated blood is blood that has oxygen inside, the red blood that has oxygen. They are taking food and nutrition to the parts of the body. So these arteries, that is where you check pulse, and it is the force, the force of your blood as the blood is going through the arteries. It is the force. So you can relate it with current, the current passing through the wires. Okay, the weight of the current passing through the wires. That is how you will know high voltage, low voltage. Is because of the amount of the force, yes, that the current is bringing. Your bulb will show light or dim. So this pulse is the force at which the blood is going through the artery. Now it is the same thing with the force your heart is using to pump. So when you are checking pulse, you are actually checking the heartbeat. So the pulse and the heartbeat, they are the same. If you take a stethoscope, put it in your ear, put it under your left breast, the sound you will hear there is your heartbeat. At the same time, use the other hand and place it on your pulse site, you find out that they are doing the same thing. They are rhythmic. So your pulse is also your heartbeat. There are so many places where you can check your pulse. Now, the instrument for checking pulse is, number one is your fingertip, the tip of your fingers. Then the second one, there are some instruments that are used to check some other things, but they have pulse reading inside. One of them is oximeter. You have pulse oximeter, Then you have digital BP machine. They are machines used for doing other things, but they can read pulse. There is actually no pulse reader that is just for pulse. You also have patient monitor. Patient monitor can also read the pulse. You can read your pulse as well. So these are instruments. Then the unit for measuring pulse, I told you, is the force. So as it's beating, I told you is the heartbeat. So it is called, the unit is referred to as beat, because it's a beat per minute. So when you check pulse and the pulse is 80, you will say 80 B/M. That's beat per minute. Do you understand? 80 beats per minute. Some people will write it like this: 80 BPM. Beats per minute. But it's like this: beats per minute. Okay. Then when you are checking pulse, a good pulse has quality. A good pulse has quality. There are qualities of a good pulse. When you are checking pulse, the pulse has, there are things you have to notice. There are things you are checking out for. You are not just reading the pulse. You are checking for the reading. You are checking for the force. This force can either be strong or weak. The rhythm, it can be regular or irregular. When it is regular, you will be hearing the sound, the lub-dub sound is going boom, 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 boom. Okay, yeah, that lub-dub. It will be regular and rhythmic. Rhythmic means your palpation. You know, it's your hand you're using, your fingertips. So you're going to be feeling like that. So that means it's regular. Then it has to be the same interval. That's rhythmic. The same interval means that the space it is giving, the rest with each lub-dub is the same thing. For example, you're getting, so it's coming at regular interval. But in irregular situations, you can hear something like, do you understand? It goes lub-dub. At a point, it will just stop. Then after some time, it goes again. Sometimes it will go fast, and then it will stop. It will come back to the regular, and then it will still go fast. So it is not regular. It is scattered. That means there is a problem. Another thing is, when you are feeling it strong, you will be feeling it very well. But when it's light, it will just be going, you just be feeling it inside. So in a situation where someone is sick, or even during operation or something like that, you keep checking their pulse to know when it goes weak. Now that weak pulse may show bleeding, internal bleeding. It might show excessive dehydration, weakness as a result of underlying sickness. Okay, the person, it could be a heart failure. The heart is no longer active to pump, so it's failing. So there are a lot of reasons why it can be weak. But whatever happens, when your perimeter, when the result of what you're checking is not regular, is not strong, is not rhythmic, then there is a problem. Okay, so you can have abnormalities in pulse, you can have high pulse rate, you can have low pulse rate, and then the normal pulse rate, because for you to talk about abnormality you should know the normal. So the normal pulse rate is between 60 to 100. Normal is between 60 to 100 beats per minute. So when someone's pulse is below 60 beats per minute, it is low. When it is above 100, that's for an adult, beats per minute, it is high. Now, that someone's pulse is high at a particular time does not necessarily mean the person is sick. It might be overexcitement. For example, after eating hot food, your pulse will go high. After running a race, your pulse will go high. If you climb this staircase, immediately you got to this place without resting, your pulse will be high. So before you attribute high pulse rate to problem, you should know the background of the person. If you dance now, after you are done dancing, your pulse will be high. The same way your heart is pumping, your heartbeat will be. If someone frightens you now, if we hear 3 gunshots now, all our mind will fly, and the next thing you see your heart panting. The same panting is the same result you will get in your pulse. Your pulse will go high. So before you classify it as abnormal, you're going to be sure you know the background. But whatever happens, don't forget to report. Then we talk of respiration. Respiration is the process of breathing in oxygen and breathing out carbon dioxide. That's respiration. So what is our business with this respiration? When we measure respiration, we want to be sure that this person is having enough air. They are able to breathe. They don't have any obstruction in their respiratory tract. Nothing is blocking their way of their airway. Then they are not experiencing any health condition that is making it impossible for them to breathe. Something like the muscles of their chest not being able to raise up and come down. For you to be able to breathe, you must have the strength to breathe in and out. Okay, then your airway must be clear and open for you to breathe. So we also check it, and normally your normal breathing as an adult is between 12 to 20 breaths per minute. When you talk of respiration, except patient monitor, I don't think there is any other instrument for measuring respiration that I know. So the unit for respiration is cycles per minute. That is C/M. That is cycle per minute. Now, when someone is having abnormal respiration, and I said respiration, the normal should be 12 to 20 cycles per minute. That's normal. And when the respiration goes high, that means the person is breathing, maybe you're counting up to 30 or 50, that means there is a problem. And for someone to be breathing fast like that, that shows that they are not actually breathing in enough oxygen. Because for you to breathe in, your chest will have to expand very well. Okay, you have a good exchange. But when someone is breathing fast, it means, yeah, they are not getting enough oxygen and they are not removing enough carbohydrate. Okay, you see that person panting, sweating too much, and it's a sign that there is a blockage in their respiratory tract, there is a problem with their lungs or their intercostal muscles or something like that. There is a problem. Okay, whatever it is, remember your work is to check and report. When you report, this person may need some oxygen, they will put the oxygen. Whatever gadget you see in your patient, you know how to use it and how to monitor it. Then you reassure your patient. Always make your patient feel comfortable by reassuring them that you are doing your best, and all the healthcare team are doing their best to make sure that they get the best and they get back to their self. Then you talk of blood pressure, BP. Talk of blood pressure, we say that blood pressure is the force exerted on the wall of arteries as the heart pumps blood within its chambers and into the body. Remember, we say that pulse is the force with which blood is going through the arteries. Now, the blood pressure is the force that the blood is giving, the tension the blood is giving the arteries. Remember, the force which the blood is going in through the artery is the pulse. The BP is the strength, the torsion, the tension this blood is exerting on this artery. Okay, for example, when you are fetching water, if you are fetching water from a tap, if the tap is big, or rather the water is plenty, and the tap, if the water is rushing and the hose, the pipe is tiny, if the hole in the tap is tiny, it will make that water to be flying. I don't know if you've done that. We always do it when the water is coming out, especially maybe you are washing car. You will go and pinch the mouth of the tap so that the water will now be flying like this. Yes, so normal blood pressure is the normal force that water is coming. Then high blood pressure is that place you pinched, and the force that blood is flying, that water is flying, that's the high. The pressure you are exerting on that pipe is now what is making the blood to either come normally or to fly. So when someone has high blood pressure, it means that this artery is experiencing a form of pressure that is making blood run fast, or the pressure to be higher and the blood is running fast. And that is why sometimes they will tell you that someone that has hypertension had ruptured blood vessel in their brain leading to stroke. They say it's cardiovascular accident. That means that artery, due to the force with which water is going, it's busted. Do you understand? It will burst the artery. So the blood pressure is talking about the artery, the force in the artery, whereas the pulse is talking about the force the heart is using to pump blood. Yes. So the heart is the engine. Go and on the borehole, the pumping machine. If the current is high, the pumping machine the tank will full very fast. But if the current is low, the water will lazily be going. So that laziness is the blood pressure. Okay, whereas the where the blood is actually going from, the work of the pumping machine is the work of the heart that is now releasing the blood, which is the pulse. So we are feeling the pulse, the work of the pumping machine. We are feeling blood pressure, the work of the voltage passing through, causing that pipe to either fly the water or be slow with it. So I don't know if you understood what I said. Okay, so in blood pressure, normal blood pressure, or rather, okay, let's say instruments for measuring blood pressure. Instruments, we have different types of instruments. Yes, we have, first of all, we have the manual instrument and we have the digital instrument. And whether manual or digital, the instrument is sphygmomanometer. If it's manual, you will be needing sphygmomanometer plus stethoscope. But if it's digital, it's only sphygmomanometer. That one that looks like those ones they carry about to check, they are digital sphygm. They are digital. The one that will read and show you the reading. Some of them are even talking. They will tell you those ones are digital sphygmomanometer. But if you're going to be using manual, you're going to use that the one that you have to use your stethoscope to listen, like the one we have. Okay, then the unit for measurement is millimeters of mercury. Unit of is millimeter of mercury. That is mmHg. So when you want to write down your reading, you write, let's say 120 over 80 millimeters of mercury. That's how you represent it. 1 over 20 over 80 millimeters of mercury. That's how you represent it. And we said the reading you are getting from blood pressure, you are getting two readings. The first is the contraction reading. The second is the relaxation reading. So when the heart contracts, it will push blood out. If it relaxes, it will allow more blood to enter inside. So when it relaxes, that blood that entered inside, the pressure that the blood came in with is always lower. You know, when you are pushing, yes, you are using higher force to push. When you are receiving, it's a calmer the pressure that you are using. So the force of contraction is equals to, you call it systole, and the force of relaxation you call it diastole. So with this example that I wrote here, 120 is the systole and 80 is the diastole or the diastolic pressure. You call it the systole or systolic pressure, or diastolic pressure. And when you talk of high blood pressure, okay, the normal pressure, let's talk of normal blood pressure is from 80 to 120, 139, sorry, 80 to 139, and the diastole is, sorry, I'm making a mistake, please, sorry. The normal blood pressure, the systolic is 120 to 139, sorry, whereas the diastolic is 80 to 100. So what this means is that when you check someone's pressure and you get 120/80, it's normal. 110/80 is normal. 110, yes, even though this is 120, but when you get 110, it's still not bad. You get 130/80 or 130/90 or 130/100, it's normal. But it becomes abnormal, it becomes high BP is when it is above 140/100. Okay, when your BP becomes over 140, it is high. Then it is low when it goes to below 100/60, it becomes low. So when someone has 100/60, a normal adult, it may be considered as low BP, except maybe it's a pregnant woman. A pregnant woman, their BP is always low because they have a lot of hormones working in them that is making their body, to be in the lowest form that will help the baby to survive. So in a situation where a pregnant woman's blood becomes high, remember they are sharing their blood vessel and system with the child. So God has made it in such a way that there will be no need for high blood pressure that will be difficult for the child's own system. So but when the blood pressure becomes high, above 120, gets to 130 in pregnancy, it's considered abnormal. Yes. Okay, but in a normal human being, 160 is a query, is low. So what you do is you report to your supervisor so that the next action will be taken. You don't do much for someone, you don't take laws into your hands, you always report so that the next thing will be done. Okay, so we talk of blood sugar. Blood sugar, it is the level of glucose in the body, in the bloodstream, not necessarily the body, in the bloodstream. Yes, there shouldn't be sugar in the excessive sugar in the bloodstream. There shouldn't be. The normal blood sugar is between 80 to 120. That's the normal milligram. That's the normal blood sugar. But when it goes higher than that, it shows that there are problems. One of the problems is that the person the insulin in their body, it's either the insulin is not being produced or it is being produced but the body is not using it. Okay, that's the two reasons why there will be problem with insulin and the body. And insulin is the only hormone that works on blood sugar. So if someone is having low production of insulin, their blood sugar will be high. continuous effect is that the person will develop diabetes. Okay, that's excessive sugar. Then in situation whereby someone is producing excess insulin or reduced glucagon is another enzyme that helps to increase blood sugar. So when there is excessive glucagon, the insulin will be low. Two of them, one must shift for the other. So when insulin is low, the person, it means that the body is absorbing all the sugar or excessively. You now see the person having low sugar. So there are some people whose problem is low sugar. Their body, their metabolism is too fast, and so their body, any sugar that comes to their body, the body will use it up immediately. So you see them always weak, always having low sugar crisis. There are some people that are like that. They can't stay for long without supply of sugar. If not, they become confused. They start feeling dizzy. They may even collapse and go into shock. The same thing with someone that has excessive sugar. If someone that has excessive sugar starts having crisis, the whole sugar in their body can intoxicate their system. When it's excess, the person can go into confusion. It can cause blindness in a long time. It can cause a lot of problem with the system, the organ, every part of them can have problem. So normal sugar in the system. I say that normal blood sugar. The normal quantity we should expect is, okay, the book says 70 to 100 milligram per DL. High sugar is, if it is fasting blood sugar, that is, the person did not eat in the morning before checking, then it should be around above 120, above and above. And if the person is doing random blood sugar, that's the person has eaten maybe 2 hours before the time, then the person's listing is considered high if it is 140 milligram per DL and above. So when someone has 140 as sugar, the person is already having high sugar, and if it continues, the person will become diabetic. Okay. And the instrument for measuring is called glucometer, and the unit of measurement is milligram per DL, milligram per deciliter. Then we talk of SpO2, which is blood oxygen. Blood oxygen, it means the level of oxygen, the percentage of oxygen in the blood is measured in percentage. Okay, the instrument for measuring it is oximeter, and the unit for measuring it is percentage. So when you check the normal percentage is 95 to 100%. Most times you don't get high oxygen, except maybe that person is on oxygen therapy, they are giving artificial oxygen, and maybe they mistakenly increased it more than required, the person can have over 100, and it is not good, it's dangerous. Then when it is below, it is low SpO2 equals below 95%. Okay, SpO2, that's oxygen saturation. That's how you represent it. If you want to talk about it, you say someone has SpO2, that's oxygen saturation, SpO2. So let's say you want to represent it, you'll be like Mr. Jones' oxygen level is SpO2 equals 100%. That's how you represent it. Okay, then the next thing we'll do is body weight. It will be good to go and read this paper, this handout. I won't talk about everything in this handout. You have to read. Then we talk of body weight. Body weight, that is the weight of your body, your size, the mass of body. And the unit, okay, the instrument for measuring body weight is what? Weighing scale. Where is scale? And the unit is in kg, that's kilogram. So we talk of the normal body weight of an adult. You know, it depends on your the body weight, the normal. It depends on your height and the size. You'll be able to know whether you are overweight or not. Normal adult weight is between 70 to 80 kilograms. When you are above 80 kilograms, you're already excess. Yes, you're over. Okay, excessive body weight, it just goes beyond whether, checking whether you are obese or not. But the thing is, for you to know, because someone can be 70 kg and still overweight. Because how do you know that someone is overweight? There is something we call BMI. BMI is calculating your weight with your height. Okay, to know if you are overweight, you have to calculate your weight with your height. That's when you will know if you are overweight. Because as tall as I am, my height and my weight, if I check it, I can be able to say I am normal or overweight. Someone that is shorter and has the same body weight with me may be referred to as someone that has overweight. Yes, so you will say, but I'm 70 kg. Is your height and your weight, are they are they approximating each other? Are they balancing each other? So the BMI, the normal BMI, that's the reading that will show you that you are okay, is normal BMI. Your normal BMI is equals to 18.5 to 24.9. You are underweight when your BMI, you are underweight if your BMI is less than 18.5 and you are overweight, when your BMI is above 29.5 or rather 25, then you are obese. If your BMI is 30 and above. So irrespective of what your weight and your height is, when you check them, it should give you something around here, and you'll be able to know whether you are overweight or underweight. Yes. So whatever results you get, the unit is kilogram per meter squared. That's what BMI is measuring. Why is it like that? Because it is a measurement of your weight over your height. Your weight over your height. We are going to check our BMI today when we are done. Yeah. It's downstairs. Go and check. Finally, we talk about pain. That's the last one. Okay. Before we go to pain, I wanted to check the formula for checking your BMI, so you can check it. Your formula for checking is your weight over your height squared. For example, if your weight is 80 kg, it's going to be 8, and your height is let's say you are 120 centimeters. And your this thing is, okay, let me use my height, 176 centimeters. First of all, what you do is you will convert this centimeter to meter. So you write 176 centimeter to meter will be equal to it's going to be 176 times 1 divided by 100, which is 1.8, okay, 1.76 approximately 1.8 meters. Okay, Okay, so with this it's going to be squared. So what you do is 80 over 1.8 squared. So when you square 1.8, sorry, I want to show off worker. Equals 3.6. When you do squared, it's like saying this times 2. That's squared. So what we have here is 80 over 3.6, which is 80 divided by 3.6. You are having 22.2. So that's kg over m squared. So that's the answer to this. The answer will now be equal to 22.2 kg per meter squared. That's the answer. So where can we classify this now? Where are we going to classify it? As obese or underweight? Is it underweight? How can it be underweight?
Underweight means they are not healthy.
It is normal. It is normal. It is normal because normal BMI said 18.5 to 24.9. So if I am 176 and my weight is 80, I'm normal. Okay, yes. But you can see that there are some people that their weight to be 80. You are too fat. Okay, you are too fat, even though I'm not up to 80. Alright. But if someone is as tall as I am and the weight is 80, it means what it means is that the strength, your strength can carry the weight. Yes, so you are not fat, you are not obese. Okay, but some people, their strength cannot carry the little weight. So it's good. So that's what it means. So when we get down, we are going to measure. Even though sometimes this, I hope you wrote down what you wanted to write. So sometimes the BMI might not really tell you the truth, in the sense that someone may have health issues that is really making them go down, but that doesn't mean they have problem. Okay, I mean, that doesn't mean they are overweight or underweight. It might be because of the circumstance surrounding them at the moment. That's why it is like that. Okay, but the BMI is a way of maintaining your weight and helping you to know that you are not underweight or you are not overweight. You are okay. Yes. So the last thing we do is pain as a vital sign. Yes, pain is part of vital sign. When someone is in pain, you have to assess that pain to know whether this pain, you talk of location of the pain, you talk of intensity, integrity, You talk of the frequency of the pain appearing. Is it constant pain? Is it intermittent pain? How is the pain? Is it piercing, dull pain, sharp pain? You know, these are things you need to ask for you to know what to do and how to manage pain. Okay, so we are done with that. Then we are going down to admission and discharge procedure. When you talk of admission and discharge procedure, you know, there is no perimeter for measuring pain, or say pain is 100 is whether you person is something that the person experiencing the pain is the only person that will tell you how severe. So you can tell them to scale it with the scale of 1:10. Where do you think your pain is? They will be like, the pain is 100%. I mean, serious pain. Okay, it's 2%. Not like I'm just having pain. Yeah. So it is the person that will tell you. We talk of admission and discharge. So when you talk of admission and discharge procedure, you're talking of what is your own part as a caregiver in receiving pain. When we talk of admission, it is hospital setting. That's when you admit. In a care home, you may not necessarily admit, you will meet the person. So when you talk of admission here, we are talking about the first thing you're supposed to do the first time you come in contact with your care recipient. It could be you are in the hospital and you have to work with the admission and the nurses. It could be you were posted to someone's house to take care of them. You will still have to do the first things first. So that is what all these things are. First thing here is welcoming the patient. It could be you are welcoming someone that is coming, or you went there and you are still creating rapport, getting to know each other. That should be a welcome, procedure whereby you ask to know the name, the right pronoun to use, the right name to call the person. Yes, the doctors that are in charge or the people that should be in charge of the person. Okay, you're going to make this person feel at home and comfortable being around you. Whatever you want to do with them, always ask for consent. That is permission. Make sure you ask for permission before you do anything for someone. And also introduce yourself. They should know who you are and what you have come to do or what you stand for. Okay, you should introduce yourself in a very welcoming atmosphere. You have to check the vital signs. Even if you went to, you should check the vital signs to know what you are working with. Okay, you need to let this person. The next thing we wrote here is an orientation. That is, explain the environment to the person. If it's someone that is coming in for admission, let the person know where the toilet is, where their clothes should be kept, their valuables, the safe place for it. If there is one or two things they will be needing during this admission, let them know. Introduce the other colleagues and people around. Let them know their neighbors, the other patients around them, so that they will feel comfortable. Allow them to choose the atmosphere they want. Do they want the lights? Do they want the fan? Do they want this or that? Yes, you have to make them comfortable in the environment. Then emotional support. Don't forget that someone is going through changes that is not comfortable. So make sure you offer emotional support. Let them understand that you are here for them. You are here for their physical, emotional, and psychological care. And you are going to do your best in providing those things and making them comfortable. Encourage them to talk to you. If they have need for anything, they are free to ask you, that you will do your best to make sure they are satisfied. So you are going to make that admission a safe and a comfortable one. Then when all things are done and you are going to discharge your patient, or you are done with the work, you are leaving, you have to say your goodbyes. You have to ensure that every document that is needed is produced. All the things you did for that day or throughout your stay. You make sure you write everything down, submit the things you need to submit, ensure that everything that this person needs to go home is with them. For example, if they need transportation to go home, make sure you ask them who is coming to carry you. Let your supervisor instruct you, okay, is it an ambulance that is taking them? Where is the ambulance? When is the ambulance coming? Ensure they are ready and waiting for the ambulance or whatever transport system. You make sure they are ready for that. Ensure that all their properties are well packed so they don't forget anything. Make sure you go around the room, make sure you ask them, check your things, be sure that everything is in good shape, ensure that everything they came with is there, they didn't lose any property. What did you say? It is your responsibility to, help them. Yes, pack their things. Yeah, you are there to assist. So it is their responsibility to take their property home, but it's your responsibility to ensure they packed everything. Of course, you have to make sure they didn't forget anything. Let someone leave their phone and go home. The next thing, the hospital stole my phone. So the best thing is, I hope you have everything. Where is your bag, your shoe? You try to remind them of every possible thing they had, okay? You need to remind them. You need to tell them. You need to make sure that when they are moving, you go around and check and be sure that all their properties are going with them, okay? Then you talk of health education. Make sure you talk to them. You know what we do with health education, whenever you see a carer with all those medication telling you take this one, take this one, take this one, make sure you eat your food before you take this one. When you get home, rest. Don't play too much. Don't, someone that maybe post-operative patient, you cannot bend down, you cannot lift heavy objects. Please ensure that you rest well, eat well, breastfeed that child very well, don't give water. Those things are health education. You are talking to them according to their health status, informing them what to do, when to do, how to do it, and what not to do. That is health education. Then you talk of final documentation. Make sure as they are going, everything is documented. Their discharge is signed by them. When they are leaving, their exit is signed by them to ensure the time of leaving and the condition of leaving. Then if you are not, if they are not going home, if you are the one going, make sure you sign off before going, and make sure they know that you are leaving with nothing that belongs to them. You are going as you came. So then you talk of post-discharge follow-up. If they have appointments, furthermore, inform them of the date, the time, who they are coming to see, and what they're supposed to prepare before coming. Maybe you're coming for a repeat scan. Please, when you're coming, don't eat. You're coming for endoscopy. Please don't eat. You are coming for this one, for ultrasound. Drink water so that your bowel will be filled up before the scan. They need water. So all these things are follow-up instructions, things you have to prepare. Then on the day of their checkup, you call to ensure, you remind them before that day, tomorrow is your checkup, please make sure you come, and all those things. They are what you need to do. Then we are going to do the concept of nursing process and patient care plan. Now, when you talk of nursing process, this is a process whereby that the nurses use to plan the care of a patient. Just like when we started, we talked about physical assessment. We say something that as you are assessing your patient, you are planning what to do with your patient. So when you are done with those things, all the vitals and everything, you will sit down with your paper and plan. Okay, this person is elderly. This person Is walking with walking stick. This person is obese and so is on special diet and incontinent of urine. Now, if this is your patient, in your care plan, after all your assessment and vital signs and everything, you start planning. You start planning on how to take care of this person. Put in consideration that this is an elderly person, therefore respect is needed. How do you achieve respect? You tell yourself. You have to add something to their name if what they need. So you ask. You are going to ask them what they want, how they want the respect to be coming. You have to ask. Secondly, walking stick. That means this person will be needing assistance with activities of daily living. Activities of daily living. Someone on walking stick will not go and bring water whenever they need water. They will not go and fetch their food whenever they need it. The fact that they are using walking stick shows they are not so free with movement. And so you're talking about activities of daily living. Then you start working on activities of daily living. What does this person need? Bathing. How do we bathe? Feeding. How do we feed? Socialization. How does this person socialize? The fact that an elderly person is using stick, it means it's not convenient for them to walk. So that means they really need a lot of emotional support and companion. So you talk of emotional support. You talk of medication. Someone on walking stick possibly has arthritis or having some pains with movement. So talk of medication assistance. Okay, you talk of exercise and ambulation and exercise. Okay, so these are activities of daily living. These are the things you need to plan. Plan bathing. How will you achieve bathing? Is this person going to go to the bathroom to bathe, or you need to be bed bathing this person? Okay, walking with stick, that means he can actually move. It's not bedridden. So with care and support, we will get to the bathroom. You discuss. Remember, in your plan of care, you are not planning alone. You are planning with patient relatives and other professional team. These are the things you're planning with. So your patient tells you, I can go to the bathroom and bathe with help. Okay. The patient relative says she bathes with hot water, so you ensure that you provide hot water. The professional says this woman is weak and needs assistance, so don't allow this woman to get to the bathroom all by themselves. So you now have a lot of information to work with. You talk of socializing. Remember, this person is obese and also incontinent.
Why is it socializing?
Who will not socialize? See this woman. So remember, we are not just talking of this walking stick. This person is obese, too fat to lift themselves. You need your heavy weight. You need your mechanism. Your own strength is needed here. Incontinent, that means they used to pee on themselves.
And it's socializing.
You must be a wicked caregiver. So no, actually, when you talk of socialization, you are not just talking of going outside. You're talking of family members coming to visit. You're talking about phone calls to friends. You're talking about going to the playground. You're talking about gardening and walking around the house. You're talking about going to church, going to support group, association, and all those things. So you're talking about communication with other people. Yes. So how do you ensure socialization? Get information about the family relationship. Does this person have family? Does this person has friends? Is this person into social gatherings? Is there any support group they are into? Is there any clinic they always attend? These are the things you need to talk about when you talk of socialization. You talk about, is there a recreational activity this person is involved with? Wants to see a movie, you have to work on it. Or wants to do whatever they are doing, you need to put it in consideration. While you are planning, immediately these are things you do in your plan of care. You talk of feeding. Now we see that this person is on special diet. So you need to make provision for those things that the nutritionist wrote down that they will take. Their fluid intake, the time of eating, the kind of food they are supposed to eat, and to ensure they are having a balanced diet, the quantity they are supposed to take. Is there any measure for their food? Are they weighing food before giving? All those things are things you have to make sure you know where they are and how to make it available. Then you also want to find out, am I the one to cook the food? Is it part of my duty? Am I the one to prepare the special diet? Is it being brought to them? Who is in charge? Who should I ask? Do you understand? If you're the one to cook, how should I prepare it? Who is going to teach me how to prepare the meal the way this person needs it? So you do all these things. Then talk of emotional support. You start thinking of, what are the things I'm supposed to be telling this person that will make him or her feel good? How am I going to rapport with this person so that they don't feel embarrassed that they are weighing on themselves? They don't feel embarrassed that they can't lift themselves without your help. How do you support them and make sure they are comfortable? You initiate conversation. You ask questions. How do you feel? Don't be embarrassed. I am here to help you. Even if you pee on your clothes, I am here to attend to it. I will make sure I clean you up and you will be comfortable as fast as possible. Let me know if you feel the urge. Let me know. Maybe we can help and see how we make sure you don't pee on your clothes. And whenever you see this person, they have peed, you ensure you clean them up so that emotionally they will not feel bad. Then you talk of medication administration. It is not your duty to give drugs, but it is your duty to assist them in taking those pills that they could have done by themselves. You monitor them, take their drugs, you assist them with identifying the right drug, you bring their drug box to them, and with their prescription given to you, you ensure that every medication is given as it is written. Take this one, take this one, don't take this one, this is for afternoon, this is for night, and all those things. You ensure that everything goes well. Ambulation and exercise. An obese person, what are the exercises that this person can engage in that will make them fit and make them to be able to move around? You don't allow them sit in one place for a long time to avoid pressure sore and other problems. So these are the things you need to plan. As you are planning, you are writing it. You need to have your care plan as a logbook, because by planning, when you are now doing those things through the nursing process, when you use the nursing process format, you find out that after assessing, you find out the diagnosis of this person, you start planning. Then after all this plan, the next thing is what? Implementation. That's doing the things you said you will do. Those things you planned, you implement them, you start doing them. I will do this, I will do that. You start doing them while you record them. When you are done, you do what? The last thing is evaluation. You now watch all the things I said I would do. I have done them. What is the result? Is it working or is it not working? I said I will be turning this woman every 2 hours. You have turned every 2 hours. Your own way is not the finish. And you'll be like, this one is not working. I think I need a hand. Someone else will have to be here with me so that we can be doing this together. I can't do this alone. Okay, you are evaluating. Or you say, okay, I'll be checking the diaper every 6 hours. You find out that you checked this every 6 hours, checked first one, second time, you find that the urine is already causing damage to their skin. You say, no, this one is not working. Maybe I'll do it every 2 hours. So that's evaluation. Trying to find out that what you have done, you got the result you're supposed to get. And if you didn't get the result, you do what? You go back again and start it all over again. You assess the situation again. You find out the problem again, why it didn't work. You do what? Draw out another care plan and start implementing again. So this is all nursing process is all about. Then we go over to documentation and reporting. It is not done if it is not written. Anything you didn't write, you didn't do it. Anything you did not document, you didn't do it. There is no evidence. So whatever you are doing, you need to write and document and report. Never keep any situation to yourself. Report. You have a supervisor. You have a registered nurse with you. You have your agency that sent you out. You have someone to report to. Okay, the reason why you document and report, your purpose is to keep track of patient's progress, to make sure that you are following patient's progress. To facilitate communication among healthcare providers. That's when you are documenting and reporting. You are informing the other ones that are not there the progress of the patient, so that when someone is taking over, they are not taking over as a novice. They know where you stopped, they continue. Okay, and it will help also to improve care quality, because when you are reporting and documenting everything, it is the team will be following. Okay, we've done this, we've done that, this is working, this is not working, so we need to increase, we need to reduce. So another reason is to defend against malpractice or any legal claim. If your patient starts accusing you of doing something, it is your report and your document that will save you. She gave me hot water. Your report says I gave ordinary water. So it is you versus what you wrote down. I took medication, I didn't take medication. It is your report that will say whether you gave or you didn't give. So you need to. And when you are reporting, you take the principles of documentation and reporting. It has to be concise, it has to be clear, it has to be correct, it has to come with compassion. You have to be human when you are doing things, so that your report and records will show how good you are. And when you are doing anything, you have to make sure you are time conscious. Do the right thing at the right time and write it down the right time. When you are reporting and documenting, do not write maybe you gave medication by 1 and you're supposed to give it by 12. Don't go and report you gave 12. It is one. You write that you gave it by one. You explain yourself. You forgot, make it there. You were busy with other things and you didn't know when the time got report. The reason is this: if you write the wrong timing, the next person will use that your timing and you may be overdosing or something like that. So don't lie. You must be honest with what you do. Okay, so there are so many types of charts and documents. You look at them and you read them. Then we go to emergency response. We said emergency response is the things you need to do immediately. Okay, when there is a problem, care assistants are often the first to notice and respond to emergencies. Okay, when you recognize emergency, and what you need to do is what? Alert medical professions immediately. You alert them and you obey the instruction they give you. And that is why you need to have your BLS, your basic life support skills certification, and the provider card, your CPR, your first aid, which is what we'll do tomorrow. We're going to go through emergency response tomorrow. So, and that's what we are going to do. So we will end here. Tomorrow we are going to go through this emergency response and everything that has to do with it. Your CPR, first aid, BLS, and all the first responder courses. We're going to attend to them tomorrow. So that is it. Do we have questions?